Hi, I'm Dr. Rob Cushman, the Medical Officer of Health for the Renfrew County and District Health Unit. Today, I probably have the most serious message for you since this started. In fact, our numbers are worse today than they've ever been, and the same applies for Canada, Ontario, and Ottawa. You've all heard about what's happening with hospitalizations, more patients, younger patients, sicker patients. We're seeing this in Renfrew County with our case count. About 60 to 70% of our cases are variants. They're much more infectious and they're infecting young people. And while we've made good progress, we've now delivered over 20,000 vaccines and we have AstraZeneca available for those who are over 55. We still have to focus on what is important. The government has said that we're basically in an emergency brake situation, a lockdown situation for the next, I guess, 3 more weeks. And it's imperative that we all do what we can to get us through the rest of April and into early May. It's only in this way that we can keep COVID, the wave 3 and the variants at bay. And if not, we're going to be in big trouble. In fact, we're already in big trouble today. And what's really interesting is people are saying, oh, they're so fed up with with businesses being shut or only half open, and we need to protect the economy. Well, guess what we've seen in the last 2 weeks? We've actually seen businesses as our principal source of trouble, as our principal source of outbreaks. We get a case in the school, we send a bunch of kids home, and 2 weeks later, we've basically found, rarely do we find an additional case. But we've had situations where people sat in the front of a taxi with a driver who was infectious. Someone went to work in a grocery store while they were infectious. They ran it, and there was this firearms course where people were infectious. And sure enough, it was transmitted from one to another. And you know what? I can understand if you don't get paid to go to work today, you'll have some misgivings. And it's terrible that you don't really get paid for having to take a day off because you're feeling bad. But it's worse if you go in there with symptoms and then a day or two later, you're told you're a contact. And on top of that, with your symptoms, you test positive. And then you realize you've infected a handful of other people in your business. And in fact, your business may have closed down. So this is serious business. So I can't tell you how important it is that we really need to bear down and do what needs to be done. Masking, distancing, and tiny groups, essentially your household, and venturing out only to do essential shopping or to go to essential appointments or to go to work. And when at work, pay regard for what the rules are and make sure that during your break time that you don't let down your guard. As I've said before, my biggest concern right now are the handful and the growing number of small businesses that are giving us problems. This is where we're seeing the bulk of our cases. So we really need to bear down for the next 3 weeks at least so we can dampen wave 3 and the variants, and so we can continue to boost our vaccination numbers. We vaccinated over 20,000 people. We're getting to the point where probably 20% of those eligible, except for the kids, young kids, in Renfrew County have been vaccinated, and in due time, in another month or so, we will begin to see the impact of vaccination. But in the meantime, each and every one of you must do what needs to be done to keep COVID at bay. So I urge you, please, to take this seriously. A year ago, we were all running scared. If you walked along the sidewalk or something, the town was dead. There was so little going on. Everyone was at home. And yet here, a year later, we've got much bigger problems. And you look out there occasionally and you scratch your head and you say, well, what's going on here? Well, sure enough, we need to take this seriously. So again, please heed what I have to say. Bear down. Do what you can do in the next 2 to 3 weeks. I've said this before. The public is the army. The public is the offense in this battle against COVID. And I'll repeat that again and again, and it's only you that can contain the disease while we in the health sector do the case management and limit the spread of the disease, and while we get the numbers up for vaccination. So please, And when your opportunity comes, get vaccinated. And we really have had very good take-up in Renfrew County. In fact, I think we've done better when you look at the percentage of our population groups that have been vaccinated, better than most areas in Ontario. So again, I'll close by saying it's time that we really focus on what needs to be done for the next 2 to 3 weeks. Thank you.